Hello guys, welcome to Periodica YouTube channel. Today we are going to discuss on Erb's palsy. If you like our video, don't forget to subscribe our YouTube channel Periodica. What is Erb's palsy? Erb's palsy is palsy or paralysis of upper limb muscles due to damage of the brachial plexus at the upper trunk. This is the upper trunk. You can see the C5 to T1 nerve roots of the brachial plexus. Upper trunk is formed by C5 and C6 nerve roots of the brachial plexus. They are the ventral primary rami of the C5 and C6 spinal nerves. Erb's palsy results when the upper trunk gets damaged at the Erb's point. Erb's point, you can see this is the Erb's point. It is the meeting point of 6 nerves. They are the C5 and C6 nerve roots, suprascapular nerve and the nerve to subclavius, and the anterior and posterior divisions of the upper trunk. You can see the red color one is the anterior division and the black color one is the posterior division. These 6 nerves are meeting at the Erb's point. Damage of the upper trunk at the Erb's point will result Erb's palsy. What are the causes for Erb's palsy? The most commonest cause for Erb's palsy is the overstretching between the head and neck and the arm of a baby during a vaginal delivery. During a vaginal delivery, there will be 2 natural forces acting on the brachial plexus of a fetus. They are the natural expulsive force of the uterus and the traction applied by the obstetrician on the fetal head. That can lead to undue separation of the head and neck from the arm and cause Erb's palsy. But all the babies who are delivered vaginally will not have Erb's palsy. So what are the risk factors to have Erb's palsy? One is gestational diabetes mellitus. What is gestational diabetes mellitus? We call it GDM. That is increased glucose level of a mother during pregnancy. That can lead to big babies. If the baby is big, it is difficult to deliver the baby vaginally. That can lead to Erb's palsy. That is called fetal macrosomia. Fetal macrosomia is a large baby. If the fetal macrosomia is present, that can be one risk factor for Erb's palsy. The second risk factor is breech presentation. What is a breech presentation? Breech presentation is normally when the babies are delivered vaginally, they are in a longitudinal lie and the fetal head will be facing the vagina. So, fetal head is called the presenting part that is facing the vagina. But in a breech presentation, the baby is lying in longitudinal lie, but instead of the head, the buttock or the feet will be facing the vagina. So, this is called a breech presentation. If the baby is in a breech presentation, as you can see, the vaginal delivery will be difficult. So that can lead, if we are delivering this baby vaginally, that can also be a risk factor to have Erb's palsy. What happens in Erb's palsy? When the upper trunk of the brachial plexus get damaged at the Erb's point, the nerves supplied by the C5 and C6 nerve roots will get affected. So the mostly affected nerves will be the musculocutaneous nerve, axillary nerve and the suprascapular nerve. So the motor branches and the sensory branches given by these nerves will be affected. Musculocutaneous nerve gives motor branches to the brachialis, biceps brachii and coracobrachialis muscles. All these 3 muscles are situated in the anterior compartment of the arm. You can easily remember these 3 muscles by the mnemonic BBC. Axillary nerve gives motor branches to the deltoid muscle and the teres minor muscle. Suprascapular nerve will give the motor branches to the supraspinatus and infraspinatus muscles. Also, musculocutaneous nerve is the lateral cutaneous nerve of the forearm. So, it supplies the sensory branches or the cutaneous branches to the lateral half of the forearm, both anteriorly and posteriorly. The axillary nerve supplies the cutaneous branches to the upper lateral half of the arm, both anteriorly and posteriorly. So, when these 3 nerves get affected, all the branches, all the motor and the sensory branches will also affected, which are arising from these nerves. When those nerves get affected, these actions will be impaired in a patient who is having Erb's palsy. So, we will try to understand how it happens. This is the flexion action of the shoulder joint. Coracobrachialis and the anterior fibers of the deltoid is responsible in doing the flexion action of the shoulder joint. When these 2 nerves get affected, the nerve supplied to the coracobrachialis and the deltoid will be impaired. So, the coracobrachialis and deltoid will be paralyzed. So, as those 2 muscles are responsible in flexing the shoulder joint, flexion of the shoulder joint will be impaired in Erb's palsy. This is the flexion action of the elbow joint. That is done by the brachialis and biceps brachii by flexing the elbow joint. They are flexing the forearm. So this action also will be impaired because in Erb's palsy, as the musculocutaneous nerve get affected, the motor branches to the brachialis and biceps brachii will be cut down and the brachialis and biceps brachii will be paralyzed. So this action also won't happen. This is the abduction action of the shoulder joint. Abduction is taking the arm or taking the limb away from the midline. So this is the abduction action of the shoulder joint. It is done by the lateral fibers of the deltoid and the supraspinatus muscle. As these two muscles also get paralyzed in Erb's palsy, this action also will impaired. This is the wrist extension. So how the wrist extension affected in Erb's palsy? Wrist extension is done by the radial nerve. As you can see in this image, radial nerve will not damaged in Erb's palsy. But the nerve fiber which is responsible in doing the wrist extension is the C6 nerve fiber, the C6 nerve root. As in Erb's palsy, the C6 nerve roots get damaged, wrist extension also will be impaired. What is the deformity that we can see in a patient who is having Erb's palsy? There will be abnormal positions in the shoulder, elbow and wrist joints. As the flexion action of the shoulder joint got impaired, unopposed action of the extensors will extend the shoulder joint. As the abduction action of the shoulder joint got impaired, the unopposed action of the adductors will adduct the shoulder joint. Also, as the infraspinatus and teres minor muscles get paralyzed, they are responsible in lateral rotation of the shoulder joint. So the lateral rotation will get impaired, so the arm will be medially rotated. So in the shoulder joint, you can see the shoulder joint is extended, adducted and medially rotated. Flexion action of the forearm was impaired. So the unopposed action of the extensors will extend the forearm. So you can see an extended forearm in a deformity in a Erb's palsy. So the elbow will be extended. Also the forearm will be pronated. Because the shoulder is already medially rotated, so the forearm will be pronated. The extension action of the wrist is impaired, so the unopposed action of the flexors will flex the wrist. So you can see an extended, adducted and medial rotated shoulder, extended and pronated elbow and a flexed wrist in a Erb's palsy patient. So this is the deformity that you can see in a patient who is having Erb's palsy. We call this deformity the Vater's tip hand because it looks like a tip hand. So we call this deformity Vater's tip hand. So I think now you have gathered some kind of knowledge on Erb's palsy. This is the end of our video. If you like our video, don't forget to subscribe to our YouTube channel Periodica. Thank you.